Good morning, friends. I am Dr. P.V. Naresh Kumar, the Chief City Surgeon of Yashoda Hospital, Secunderabad. Today, I would like to discuss with you how do we treat heart patients during the times of cardiac COVID disease during this COVID pandemic. So these are all the protection equipment which we have. You see, this is the N95 mask which we have to have compulsory as soon as you enter the hospital. This is a face shield which is very essential to prevent any droplets from falling on your face. Just for the sake of recording this video, I'm just taking it out. This is one of the respirator which we call as a half face respirator, which gives you almost 99.97% protection. So now coming to the heart diseases, see, there are almost 9.5 million deaths in India every year in our country. So out of these, 2.3 million are due to heart diseases, heart which is called cerebrovascular disease, heart disease, heart attacks and stroke. So if you calculate it, divide it for each month, it comes to nearly 1.75 lakh deaths. So in a month, all around in our country, we are having 1.75 lakh deaths due to heart disease and stroke. And if we see for the last 3 months since we had this COVID infection, we had till now almost 2,700 deaths. And in the last 3 months, if you say, it is coming to 900 deaths. And most of the COVID infections have been mild. You can say 80 to 85%. You get only symptoms of cold, cough, and you may not need hospitalization also. But in case of heart diseases, the infection, the death is mostly occurring. That is, nearly 68% of the deaths are in the age group of 30 to 70 years, which is supposed to be the most productive years of life. So, coming to the topic, I would like to first give an idea of whether a COVID patient can have symptoms like heart. Yes, it is possible. Normally, a COVID patient can have regularly like respiratory symptoms. He will have cough, sore throat, and fever, which usually within 2 to 3 weeks they would settle. They can present to us with symptoms of heart also. So what could be the symptoms? He could have chest pain and he could have cough, or if a patient who has already suffering due to some heart problem can become more sick if he gets a COVID infection. Now why this happens? This happens because whenever there is a COVID infection, the virus which is circulating in our blood, it creates something called an inflammatory response or a reaction. And that reaction, because the blood supply goes into the heart muscles, it can cause a reaction called myocarditis, and the heart becomes weak for temporarily. And because the heart pumping is deficient, you can get the patient get symptoms of chest pain, breathlessness, swelling of the legs, and other symptoms like a heart patient. So usually the other common symptom of heart patient is chest pain. That happens because you can see this is the section of a artery of the heart where there is a plaque. We can say this is a cholesterol deposition. So normally if there is some tear or a rupture in the surface of the plaque, a clot gets accumulated here and can cause sudden cause of pain. That is the normal way a heart attack develops, acute heart attack develops. In COVID patient also they can come with similar symptoms which are similar to heart attack. So whenever we have in an emergency a patient coming with heart symptoms, we should first do some screening tests and rule out whether he is really having a COVID infection, and also treat his heart problem and also his COVID infection, and keep him in an isolation, and all other necessary precautions to be taken. Now, for a patient who is now under lockdown and they are in their homes, it is possible that they get some symptoms, like a person who was earlier had a heart attack and he had undergone bypass surgery, or he had undergone a valve replacement. He can get some symptoms, and if he may be confused that is it because of COVID or is it because of my heart problem. So in such situations he should not worry. What we would suggest is you consult any of your doctor friends. You would be having some friends who would be an MBBS doctor or a physician or possibly a cardiologist, and get some advice from him. If you are not having access to any of your doctor friends, you can get a tele consultation to Yashoda hospitals, where all the doctors, the cardiologists and the CT surgeons and more are available morning to evening. Most of the doctors are available morning to evening, and in the night time, that is during the emergency time, you have a separate emergency team. And how do we treat now? Suppose there is an emergency, there is a possibility we can always also send an ambulance to your house and you can come to the hospital. There would be a separate emergency for patients who are not COVID patients, and who are patients with fever or cough. We have a separate emergency. So there is no mixing up or patients getting infection from others, and also the doctors also not transmitting infection. So that segregation is already made. And what we do is, once we know that we see in the OPD, in the emergency, that you have no COVID symptoms, and then we do some screening tests like CT scan and some blood investigations, and then take you up immediately for an angiogram if we feel from the ECG and echocardiogram that your cardiac condition is an emergency. Once we do an angiogram, we see if your arteries are blocked, and if they are blocked, the cardiologist may decide to do an angioplasty or a stenting immediately. Generally, it is advisable in these situations that if you are having, you should not postpone your treatment. Sometimes what we see is our patients come and they say, okay doctor, now I am subsided, my pain has subsided because of your treatment, so I will do it later on. You should not do like that, because during COVID times we don't know. Once you go home, you can catch up infection and you may get sick, more sick. So always better to get the treatment, complete treatment done. If suppose after angiogram there is a blockage in all the arteries and the cardiologist suggests you to go for a bypass surgery, it's also advisable you go ahead with bypass surgery, which can be planned in the coming 1 or 2 days. So in conclusion, I would like to give a message to all our heart patients that more and more people are dying due to heart disease than COVID. So during these times of COVID, where the news and the media are all focusing on only COVID, not much awareness is really known about what patients are dying due to heart attacks and stroke. So if you have the slightest symptom, please don't hesitate and can consult our hospital or doctor, whoever is nearest to you. Thank you.